Schwartz. She is a part of the Ohio affiliate of Prevent Blindness. And this is a program that is throughout the United States. And the headquarters is out of Chicago. Right, yes. Okay, and she's going to talk about the aging eye. And so really excited. There's a lot of brochures back there that I brought, that she brought. Please take a moment before you leave today to check that out. And these are resources for you to take home. All right. So Laura, you're up.
I'm up. Okay. Well, thanks for having me here, Carrie.
Yes.
If you let me know if you can't hear me, because I tend to have a light voice. So I am the Special Projects Coordinator at Prevent Blindness. That's been my title for many years there. And so what falls under that right now is I provide adult vision screening training, and I know that Carrie was trained and some other people from Holmes County. And I also coordinate Ohio's Aging Eye Public-Private Partnership, which is a group of organizations throughout the state trying to raise awareness about taking care of your vision as you age. So this is a good chance for me to do that. And I coordinate, we have a couple of fellowships that we give for summer research, and some various and sundry other things. And with me today is Karen Stone, and Karen is in the back over there. She is our Vision Care Outreach Coordinator, and we stopped at the health department to meet Jen, who refers clients to us for assistance with paying for their vision care. That's something that we are able to do, and then if you have questions about that, Karen or I would be happy to answer that. I'm hoping we'll be kind of informal. I have a lot of slides. I'll try not to kind of PowerPoint you to death, but if you have questions, just kind of stop me along the way. And I'll tell you a little bit about Prevent Blindness. So we're the Ohio affiliate, and it's a national public service, public health organization. We don't have affiliates in every state, but we do have many affiliates. We try to cover the rest of the country. In Ohio, we cover all 88 counties somehow through providing vision care, through training and information. We do adult vision screening, and we also train school nurses to be children's vision screeners, and people for Head Starts and those kinds of things. But really what we do is we promote eye health and safety, right? You only get one pair of eyes. Our old CEO used to say you get one pair and no spare. So you have to take care of your vision. So our mission is really, just to prevent blindness and preserve sight. 50% of all blindness can be prevented, and really prevented through early detection and treatment. So how we do what we do is really through public information. We want to get the word out to people, right? Research, we have the research grants, and we work with researchers throughout the state. We put on a conference every year, the Aging Eye Partnership. This year it is June 23rd. It's going to be held hybrid, so live at Ohio State, because we work with one of the colleges as partners, but also it's going to be online, so any of you are welcome to join us online. It's going to be the morning of June 23rd, and that is called the Aging Eye Summit. And then we're really about early detection and treatment. We do vision screening, and we train people to be vision screeners, but if we find somebody who is showing some type of problem with their vision, if they don't get into an eye doctor and get treated somehow, there are chances that they may lose their vision. We're going to talk about the 4 major aging eye diseases and kind of give some more detail about that in a minute. So vision problems are growing. They're growing as the population ages. I think most of us are baby boomer population in here, count myself among that. But also there are lots of people who don't realize that they should get regular eye exams, or they think that they don't have access to eye exams. I would think that some of you are on Medicare, I am, and Medicare only pays for glasses. Hopefully, after cataract surgery, Prevent Blindness can help people with glasses in that case. But people don't always understand their insurance benefits for vision, and that's something that Karen and Pam out of our Vision Care Outreach Program can help with. The increase in diabetes increases vision loss, and smoking, high blood pressure, cardiovascular problems in general, and eye injuries. Also, there are a lot of health literacy issues around vision. I don't know if any of you have grandchildren, but a lot of people don't know that their children should have an eye exam well before kindergarten, because we're looking for things like lazy eye, amblyopia, that needs to be taken care of before the visual system is fully developed. So we recommend that children get an eye exam young, before their kindergarten screening. Somebody have a question? Okay, but also, you know, a lot of people with just poor health habits and a lot of chronic diseases affect vision. Also, the obesity epidemic weighs heavy with the diabetes epidemic, right? So they kind of go hand in hand. And people who don't have vision insurance, or it's not good enough, it doesn't cover enough, the people who are underinsured, and then there's a lot of health disparities, you know, throughout the country, of people who maybe culturally, it's not part of culture to go in unless you see a problem. There are some people who don't go to the doctor unless they see a problem. Some research that they do out of the Department of Health, why people don't go for eye exams, because they don't see a reason to. They think their vision's fine. It isn't always, so we need to get people in for eye exams. So the effects of vision loss are significant, and I don't know how you all feel, but what would you miss the most if you lost your vision? Do you know?
Seeing my grandkids.
Seeing your grandkids? Yeah.
Doing
Anybody
my
else?
sewing.
I'm sorry?
Doing my sewing.
You're sewing, right, right. That being able to see close up, reading and seeing my birds, my nerdy birds. But that, yeah, and people who lose their vision have a 50% increased incidence of falling. People who have low vision or who are blind. And people who have low vision or are blind have an increased tendency towards depression. They often feel really socially isolated, and they don't have a good image of themselves in terms of their health. Also, you know, loss of independence, right? If you lose your vision or you have low vision, you can't drive, may not be able to get around as easily as you would like to. So that also increases the likelihood of being admitted to some kind of nursing care facility, assisted living, whatever. And also there's been a lot of research in Ohio, up at Case Western and also at Neomed, the connection between low vision and earlier development of Alzheimer's and also cognitive decline. So it's disorienting, right? When you can't see, I mean, those of us who wear glasses, when you take your glasses off and you're trying to get around, even to get in the shower, it's disorienting when you can't see. So if you can't see all the time, there are lots of effects to your personal life. So this is just quick eye anatomy. There's going to be a test at But you know, the eye's complicated, right? Because the light passes, you know, in through your eye into your optic nerve. You know, their impulses are made, electrical impulses, to translate the image through to your brain. So we're going to talk about the cornea is that front protective layer of your eye, And, then the focusing lens, focuses light, into the back of your eye. And the iris is kind of like, the camera lens, it opens and closes, and it gives your eyes, their color. And then the retina are the light sensitive cells, that, help, translate what you see, from your eyes to your brain. And then the center of the retina is the macula. And I'm showing this because we're gonna talk about macular degeneration and those kinds of things. So the macula is that point of central vision. So if you like to sew and you have age-related macular degeneration, it's going to be hard for you to do that close-up work because it affects your central vision. And then the optic nerve, again, that transmits the images to your brain, impulses to your brain. And they can't transplant an eye. There are some people who believe that they can, but because of how complicated the structure is and because of the optic nerve, they've not been able to transplant an eye. They can transplant corneas, they've made huge advances over the years in terms of preventing the diseases, but they still can't transplant an eye. So I'm gonna talk about the 4 primary aging eye diseases. And they are age-related macular degeneration, or AMD. Some people will call it just macular degeneration. Cataracts, which they say if you live long enough, everyone's going to get a cataract. I'm sure some of you have had cataract surgery already. And it's a miracle, really, in the United States that we have that surgery available to us here. Doctors Without Borders, the ophthalmologists that go overseas, countries that don't have ophthalmologists, they'll do cataract surgery after cataract surgery and give people back their vision. I mean, it's pretty remarkable to hear some of those doctors talk. And then glaucoma, which is that loss of peripheral vision, and diabetic retinopathy, or diabetes-related retinopathy, they're the same thing. And we're gonna go into each one a little bit more in depth. We're gonna start with macular degeneration, and this simulation is what it might look like if you had macular degeneration. You start to lose that central vision. And I brought, and they're in the back, I brought you these simulator cards so you could look through them and see what it might look like to have AMD, and you're welcome to take them. So they're all the aging eye diseases, as well as amblyopia, which is the lazy eye. Lots of older people lose their vision to macular degeneration.
What causes that?
So there are cells that break down and leak, so people start to show some protein, some drusen. I don't know if any of your eye doctors have told you that they're following drusen. My eye doctor looks, so a comprehensive eye exam is when your eyes are dilated or there is a retinal photo, and people start to develop a protein. It happens as you age. The protein's called drusen, and it eventually can turn from the dry AMD to wet AMD, and there's this growth of unhealthy vessels, and it's partly genetic, it's partly from the aging process. It is more common in Caucasians and blonde-haired, blue-eyed women. So, and if you have a family member who has AMD, it increases the incidence of AMD. Exposure to the sun over a long period of time, you might develop drusen earlier. So for instance, I lifeguarded and taught swimming back in the day, and I started developing drusen in my 40s. Fortunately, my eye doctor follows it and always shows me my retinal photo, and it has not changed for the worse. I take vitamins, the age-related eye disease vitamins. Have you heard of those? If you hear the term ARIDS, so ARIDS is age-related eye disease. And there were two big national studies, the ARIDS 1 and the ARIDS 2 studies. And they were looking for the proper formulation for these vitamins that are have antioxidants in them, and lutein and zinc and vitamin C's in it. And I actually think there's a lot of good stuff in these vitamins. The recommendation is now that people take the ARIDS 2 vitamins, so it's Preservision, there's an Eylea, and Optivite, and then I think that there's generics now too. If your doctor sees drusen, he or she may say to you, you know, you might want to consider these vitamins, or supplements. They found that they don't make a difference before you have drusen, but after they slow the progress of AMD. I will say this while I'm kind of jumping around, but the pills can be big, and you know, no one likes a big pill in their throat, but they do have chewables and gummies now, and they're worth a little bit of extra money. And I would say, I found personally not to take them right before I go to bed and then lay down with this pill that hasn't moved down yet. So I take them in the morning. Let's see, where am I? So the symptoms of AMD can be blurred vision, or you might see some central vision, some shadows in your central vision, trouble like discerning colors, especially dark from light. We're going from bright light to low light, which we all have some of that, especially as we get older. But sometimes people don't see any symptoms at all. But one of the things is that people will see lines that are supposed to be straight and they'll look wavy. And I don't know if any of you, and I don't want to call anybody out, but if any of you have AMD and have noticed that, this Aging Eye Partnership that we work with, every year we take a report, and I put one in the back for you, the Aging Eye Partnership, Public-Private Partnership report. We take it to the State House and give it to the people in the House and the Senate. And one of the senator's assistants, administrative assistants, called us a few weeks later, and we had put on the back what's called an Amsler grid, and it looks like a piece of graph paper with a dot in the middle, right? And she noticed that the Amsler grid looked wavy. She called her eye doctor. She thought she was having some problems. You know how physically you have this, like, I'm having a problem here, but it'll be fine. She thought she was having some problems, but she hadn't gotten to the point where she thought she should do something about it. She called her eye doctor, and she had the beginnings of AMD. And the sooner you catch it, the better, because there are a lot of treatments. And the sooner you treat, the less vision loss you have. So I brought you some of these, but I also brought you magnets that have the grid on it if you want to put them on your refrigerator. We have one on our refrigerator at work, and I look at it still, even though I have regular eye exams. So you might see some wavy lines. Karen?
Would you look at that with your glasses or without?
With.
Okay.
Yeah, and there's instructions on here how to use it. And Betty White, she was our sponsor for this program in particular. So yeah, it tells you how to do it, where you put the chart, and you stand about a foot away and cover one of your eyes. She covered her eyes with her hand, and I know I don't recommend that when we do vision screening, because people's hands are dirty and we don't want you to get an infection, but anyhow, you can cover your hand. We use Dixie cups when we train. But often there's no symptoms. And this is why you need to go in for eye exams, because a lot of these, there aren't any symptoms. And for clinical signs, what your eye doctor will see when they do a dilated eye exam, or when they take the photos, they're gonna see some drusen, that yellow or whitish deposits. And they're gonna see that the light cells are starting to break down a little bit. And they might see more retinal blood vessels. And And what we'll see when we do vision screenings is that we'll see that somebody's visual acuity, their ability to read the letters on the charts, has gone down significantly. But, you know, increase, you know, in cells that are new, blood vessels that are new, they tend to break down, more easily. So the risk factors are, I think I kind of mentioned some of these, but, age, you know, it's age-related macular degeneration. So it's aging, your family history, if you have a parent or a grandparent or a sibling or a child, you're more likely to have AMD, more common in people who are Caucasian, women, and people who are farsighted. And then we do this thing with lifestyle factors. These are really the things that are somewhat controllable. So, you know, I think you've probably heard forever and ever about smoking's not good for you. Well, it's not good for your eyes either. It's not good for all the vessels in your eyes. So, smoking, obesity, and cardiovascular or blood pressure, and exposure to sunlight. So my eye doctor says to me the last time I was there a few months ago, "Now, Laura, do you have good sunglasses?" And I'm like, "Well, you know where I work, right? You need good sunglasses, and you need sunglasses that protect from both UVA and UVB rays." And the same thing with your kids and your grandkids. I know a lot of people buy those really cute sunglasses for their grandkids. Well, sometimes they're just sunglasses that dilate their eyes, but doesn't necessarily protect for UVA and UVB rays. There's usually a tag on your glasses that will say what they protect for. And if you get your sunglasses from your eye doctor, they're gonna sell you eyeglasses with protection. But even, you know, drugstore sunglasses are fine. You just wanna make sure that you're getting out of them what you should, not just from the glare, but also to protect you from the rays.
What about, when you have the glasses that change
The phone,
to the dark?
yeah, the transitions,
Mhm.
the phone, yeah,
Mhm.
they're fine.
Oh, okay.
Because they're formulated to protect for UVA and UVB
Okay.
rays, yeah. So cataracts, like I said, if you live long enough, everybody gets a cataract. And cataract is really that just clouding of your normally clear lens. And, you know, the clear lens is going to focus sharply, right? But if it is a cloudy lens, it's not gonna focus well. So 96% of all cataracts are age-related. But some people get cataracts younger for a lot of reasons. So congenital cataracts are usually due to an infection or a medication, perhaps, in the mother that's passed on to their child. There are also traumatic cataracts from a chemical burn or a hard blow to the eye, or surgery, or too much heat, too close to your eyes. So that can give you a traumatic cataract. And also secondary cataracts, so like from medications like steroids. You know how they, I don't know if any of you have been on steroids, but except, you know, they're great in terms of helping you with what you need. On the other hand, there are side effects, and one of the side effects is that it increases your risk of having cataracts young.
Once you have cataracts removed, can you have them again?
So there are a kind of secondary cataract, so you could, it's not so common, but some people do get a what they call a secondary cataract. And you know, there's two different kinds of intraocular lenses they can put in. They can put in the standard one that you know, corrects your vision, but they can also put in the ones that can correct for near and far, and you pay a little bit more for them. I know, a little bit, maybe that's it's a couple $1,000, I think, at least more. But you may not need to wear glasses.
But those aren't, those ones that they put in that cost a couple thousand, That's just a corrective, that's not a cataract, is it? Or
Oh,
is it?
I think you might be talking about LASIK. You're talking about LASIK where they, go in and use a laser to correct your vision?
I don't know, one of the girls I work with, she went and got a second job in
Mhm.
the evening until she could save up enough money. And then she went and had this eye surgery, so.
Yeah, that's LASIK, yeah.
That's lazy.
And it does correct your vision. One of my daughters had it. She was getting eye infections a lot. She works at a hospital and she had to wear a mask and her glasses were always fogged up and, I wasn't so sure, cause one of the doctors, you know, this has been maybe 15 years ago, and I asked one of the optometrists what he thought of LASIK, and he said, I don't think there's enough data out there yet. But there is quite a bit of data out there now. And I know my optometrist had LASIK, but that's to correct, you know, your nearsightedness and your farsightedness. My daughter loves it. Wish she'd done it younger, but.
Well, I had eye surgery maybe 3-4 years ago. You know, I was probably 80, 81,
Mhm.
so I was wondering,
Cataract probably?
it's cataract,
Yeah, probably cataract.
so
But they correct your vision.
it did correct it.
You're right.
And now since, it's been, I guess, about 3 years. And, so since then, I had to change my lenses.
Yeah,
They changed a
they
little.
change, they still change, yeah. But for a while there, could you go without wearing your glasses?
Well, no, because, I could, but he said there was a little bit of correction there. And so I went ahead and got them because Medicare paid for it.
Right, that's when they're supposed to.
And so this time, I already had the new glasses, so I just had to change the lenses.
The lens.
He told me one, but when I got them at Walmart, and she told me down there that, one was a plus and one was a minus, and she said that would mess me up, I should do both of them. So I thought, well, I'm not gonna take any chances. I
Right,
did both.
you know, glasses can be very expensive, but you want them to be right for you. It's something that you wear every day, usually whenever you're awake.
Yeah.
So, you know, you wanna get the best you can.
But I can drive without glasses, it's the close stuff,
That's the
you
near,
know.
your near vision, yeah. You know, I kinda joke that I can't wait to get cataracts, so I don't have to wear glasses for a while.
But now I'm on Plaquenil, and that can affect your eyes.
Mhm.
So
Lot of
I have to
medication.
have my eyes checked every year,
Yeah.
cause if it starts affecting them,
Mhm.
then I have to go off of.
So I venture to say that, cause you said how old you are, so that everybody your age should probably have an exam every year. And anybody who has diabetes for sure should have an eye exam at least once a year, if not more. So the symptoms of cataracts are just kind of that same thing, that loss of visual acuity and reduced contrast, and you can be dazzled by strong lights and see halos around streetlights, and you see colors a little different. I don't know if any of you are fans of Monet, but you can see his paintings before he had a cataract and after of the gardens, and they're yellower. They're kind of a brownish yellower because of his cataracts. So the risk factors again for cataracts, you see the cigarette again. It's heredity. So if you have family member who developed cataracts young, that likelihood is going to happen for you too. Diseases, diabetes included, long-term steroid use, eye injuries, a lot of inflammation, smoking, long-term exposure to the sun, and then again, aging. And then this is a simulation of diabetic retinopathy, where the blood vessels in the retina can break down and bleed. And often there aren't any warning signs. There might be some macular edema or bleeding that your eye doctor might see. But people, this is one of the really big reasons that people with diabetes should get in for an eye exam at least every year. And when they're first diagnosed, that should be right, part of everybody's plan when they're first diagnosed with diabetes. My eye doctor says, you know, I can tell by looking at people's eyes that there is a good chance that they have diabetes. Now, I can't diagnose it, but I can tell them from looking at your eyes, I'm concerned that you may have diabetes and you should go to your primary care doctor, get an eye exam. I mean, get an exam for diabetes. And he says that next year, people come back still complaining about their vision, but they haven't gone in to see if they have diabetes. Well, fluctuations in blood sugars levels make a huge difference with your vision, and people who need new glasses need to have their blood sugar a little stabilized to make sure you get glasses that work, that are correct. So we really push this. I say a lot. So the risk factors for diabetic retinopathy are really, obviously, diabetes, and the longer you have diabetes, the higher the risk factors. But also it's more common in ethnicities of color, and it's more common, so interestingly, it's more common in women, but men have worse cases, because they tend not to seek care as quickly. And the longer you have the disease, and retinopathy can also be a risk factor for cataract and glaucoma because of diabetes and what it does to your vessels. So the lifestyle factors that they talk about are, maintaining a good blood sugar control. That A1C has to be in line, and hypertension, smoking, alcohol. So alcohol and diabetes, go together real well. And then, I don't know, I laugh when I say this, like, as a lifestyle factor, but women who have diabetes who are pregnant tend to have a higher incidence of retinopathy. And so they might recommend an eye exam every trimester. But people who have diabetes just shouldn't mess around with their vision care. Nobody should, but particularly people with diabetes. And then glaucoma is, as you can see from this simulation, that's that loss of the peripheral vision. You can see that the central vision's still there, but the peripheral vision, that side vision, is gone. And that is really due to this pressure on the optic nerve. When you go to the eye doctor, hopefully everybody goes to the eye doctor, and you get a test that's testing your peripheral vision. Sometimes you get like a puff of air in your eye to test your interocular pressure. Sometimes you're doing these clicks where you see the little wiggly light. That's checking for your peripheral vision. The puffs are checking your interocular pressure, IOC. They call glaucoma the sneak thief of sight because there aren't any warning signs. It just can happen so slowly in the open angle or the chronic glaucoma. The closed angle can be painful, and that sends people to the doctor more quickly. And when we teach people to do vision screening, we say that's the emergency one. That people who have that pain in and around their eye should see their eye doctor, or to go to the emergency room, but to get in for some care that day if they can. Because they can be prevented from losing their vision. Because once vision's lost, it can't necessarily be recovered.
That's not a torn retina, is it?
No. Mm-mm.
Okay.
But for a torn retina, you need to go in quickly too. To your eye doctor, yeah. So the symptoms of glaucoma are that loss of side vision. And some people will say, they're driving and a car came out of nowhere, and it may be possible that they didn't see it because of that loss of their peripheral vision or their side vision. or it could be just what they said. But that blurry or foggy vision and difficulty adjusting to dark rooms and rainbow color rings around lights. But the thing with glaucoma is it can sneak up on you, and that's why you need an eye exam. You want a comprehensive eye exam so that the doctor can look in the back of your eye and look at your optic nerve and see that it's healthy. There's so many new treatments out there for glaucoma. The first line of defense with glaucoma is our eye drops. And the eye drops are generally used to lower the pressure. And I know people don't like to put eye drops in their eyes. They run down your face, they're kind of gritty, they're a little expensive. But if you can lower that pressure, you may be saving your vision. I have a lot of eye doctors who tell us when they come to do training programs for us that people aren't compliant with their eye drops and that they're losing their vision, and they shouldn't have to be. But there are also surgeries there, and there's laser treatment. There are a lot of treatments for glaucoma. And actually all of these aging eye diseases that I mentioned, in the last, I've been at Prevent Blindness almost 20 years. I know I don't look that old, I probably look 20. But there have been these huge advancements in terms of what can be done if you get in early and you get treatment. So the risk factors for glaucoma are, again, that high interocular pressure and heredity. If you have a sibling with glaucoma, well, get in for your exam because it raises your incidence quite a bit. And that's more common in people who are African American or Hispanic. People who have a central cornea thinness, so that was partly our worry about LASIK surgery. Because does LASIK surgery thin your cornea, and is it gonna leave people open later on to glaucoma? We don't know that, and it's more common in men. So those are the 4 major aging eye diseases. Any questions, comments? Okay, so now this is what you can do. Really, the more you take care of your body, right, the better health and eye health that you're gonna have. So we want you, these are the things that you can do to lower your risk. And I know I mentioned them with each one, but avoid smoking, eat healthy foods, you know that, eat the rainbow, colorful foods with antioxidants, stay active and control your blood pressure and your blood sugar. Protect your eyes from the sun. So if you're gardening, you should have sunglasses and maybe a hat on. And get that regular comprehensive eye exam. And if you need assistance, if you don't have insurance or you need assistance paying for things, feel free to take one of our cards or flyers back there, or contact the health department and say that you would like to be referred for help with your vision care. I think people should have this, put this up as a poster in your eye doctors, right? Yeah, just that whole lifelong nutrition. These are pretty self-explanatory. Blood pressure, protecting your eyes from the sun, wearing a hat, we've said all this already. There you go. So, questions, comments?
I have a question.
Sure. And I'm not an eye doctor, by the
A
way.
long time ago, my son had his eyes fixed for one short and one long.
Mm-hmm, for the monovision, for,
And I really didn't approve of it, but they're his eyes. And he just didn't want to have to wear glasses because he was a painter.
okay.
And so now he's having a little bit of problems. So the doctor said, I'll make you driving glasses. So I don't know. I'll see how
I
they
don't
work.
know. I mean, there are things, and people who have low vision, there are binocular driving programs. So people with AMD can perhaps drive, I mean, depending on if you're a candidate for it. Ohio State has a whole clinic, a binocular driving clinic, so, yeah. I mean, it sounds like his eye doctor's,
You know, and he would never let the doctor, when he would go there, he would never let them dilate his eyes, because, most of the time, the doctor will tell you not to drive.
Right.
Or wait. And since I'm by myself, I go there and they dilate my eyes and I read a book for a while before I leave.
right, and they give you those sunglasses that still don't do enough, right? Yeah.
Well, I have two in my wallet, so I have two of them.
Oh, we were double pair?
Yeah.
You know, that is, I know a lot of people don't like to have their eyes dilated for that reason, and because you want to go, right? Everybody's in a hurry and you want to get up and go. But a dilated eye exam is really like the gold standard. But if not, they can also do retinal photos, and they charge you a little bit more for them, but I think my eye doctor charges $8 to $10 more for the retinal photos, but they are, you know, I guess I think worthwhile. So, has everybody had an eye exam in the last year?
Yep.
Yep.
I go every year.
Good.
Now, I said that, asked your doctor about the vitamins. So if you go and get eye vitamins, you should really ask your doctor before you go on them or not?
Yes, you should ask your doctor, right? Because it may not be indicated for you, right? So if you're not showing any drusen, then it's not indicated yet for you for that age-related eye disease vitamins, right? And if your doctor recommends them, then yeah, go ahead. But
So basically with that, is that it's really not a preventative measure, like vitamins usually are.
Right,
It's
they're not
something that's starting to be taken after you've been diagnosed with.
with dry AMD,
Yes.
and it slows the progression from dry to wet.
Okay, so there has to be a diagnosis first.
I mean,
Just so it's starting.
you can go to the store and buy them, but they found that it's not making a difference. Yeah.
Okay.
Yeah.
Cause they tell you should take what, lutein for your eyes?
Lutein, yeah, I mean, yeah,
My father had macular degeneration and his doctor said that his children should all watch for it and take zinc, even as a
is
preventative,
it preventative? 'Cause
not
zinc is
waiting
part of it.
until, not waiting until it was diagnosed.
Oh, interesting.
And so far, so good.
So far, so good, yeah. And I think what's in the vitamins, there are some really good things in, like, in terms of what I read in terms of COVID. There are some good points, but the ophthalmologists and the researchers that we know, Ohio State participated in the ARID studies, and we do a lot of work with Ohio State. And their ophthalmologists, you know, say, you wait. I think it's just a baseline, right?
Well, I had a friend that had macular degeneration, so he took, you know, all those vitamins.
Mm-hmm.
So, you know, he told me they really helped and I should take them, so I did for a while, and then I quit. And then the last 6 months I started again.
What's your eye doctor say, or did you not ask?
I didn't ask him, I went in January or February and I didn't even think about it.
Has your eye doctor mentioned any drusen?
I was thinking maybe my regular doctor might have mentioned it, somebody did, but I'm not sure who.
Generally, your regular doctor wouldn't do
You
that
wouldn't
kind
have
of.
mentioned it. And then
No.
you hate to call up there, I mean, I don't know what they think. I have to go every year, but I won't go till next January.
Yeah, you know, I don't think it hurts to say, you know, I went to a talk and they mentioned this, and, you know, do I have drusen? Does it make sense for me to take these vitamins? Did you, when they do the, before they do your exam, did they ask you what medications you take? Did you say you took the vitamins?
But I don't know whether I put down that I